In the far north, where mountains meet the sea, life has always demanded strength. Stiffness and pain has always been part of our life here, something we blamed on the winter, on the work, on the years. But what if some of that ache was not just the cold? I am a rheumatology researcher from Norway, which means that at some point I had to ask myself a very Norwegian question. Did the Vikings have rheumatoid arthritis? And if they didn't, why not? Because the answer tells us something fundamental about risk. If RA existed in the Viking Age, long before smoking or industrialization, then we're looking at one kind of a disease story. But if the Vikings never had RA, then we're looking at a completely different story. And here's where it gets interesting. RA doesn't enter the medical record until 1800, and for a disease this disabling, that silence is puzzling. And this leaves us with three competing explanations. First, the modern hypothesis, that RA is a new and modern disease. Second, the ancient hypothesis, that RA has always been here, just poorly described. And third, the transatlantic hypothesis, that RA came from the Americas. Three theories, three timelines, and three very different implications. Let's start with the first theory, the idea that RA is a modern disease. Picture yourself stepping into a Paris hospital in the year 1800. Patients lie in shared beds, instruments are reused, and clinical observation is the physician's strongest tool. In this world, a young doctor named Landry Beauvais records something new. A chronic deforming arthritis affecting poor women, spreading across many joints and causing severe progressive disability. Then in 1859, Alfred Gerard gave it the name rheumatoid arthritis, clearly distinguishing it from gout. And by the late 19th century, physicians like Charles Short pushed this idea even further, stating that RA was a new disease shaped by changing environments and modern life. Supporters point to a hard-to-ignore gap. If RA was common in the ancient societies, it should show up in their stories, like the Bible or Shakespeare, but it doesn't. The second theory takes us far deeper into history. It argues that RA is ancient, present for millennia, but described in fragments across early medical writings. And indeed, some of these accounts resemble RA closely. Take Hippocrates, for example, who described an arthritis beginning in the mid-30s, spreading symmetrically from the feet to the hands with wasting of the limbs. And in ancient India, Charaka, also known as the Indian Hippocrates, described a chronic symmetric polyarthritis with nodules, contractures, and muscle atrophy. And there are other scattered descriptions that also seem to echo the same pattern. But some of the most intriguing evidence comes from the art. Across Europe in the 1500s and 1600s, painters captured hands with RA-like patterns. Like in this Flemish painting, the beggar's hand shows ulnar deviation, finger contractures, and wrist collapse. And in Rubens' Three Graces, the left figure's hand displays deformities strikingly similar to RA. So in this theory, RA didn't suddenly appear. It has always been there. We've just failed to recognize it. The third theory suggests that RA may have originated in the Americas. After 1492, when Christopher Columbus arrived in the Americas, sustained contact between the Old and New Worlds began for the first time. People, animals, foods, and microbes suddenly started moving across the Atlantic. And we do see strong skeletal evidence. We have symmetrical small joint erosions going back thousands of years in Alabama, Kentucky, and Ohio. And these lesions look much like modern RA, and they appear repeatedly across time and place. Skeletal evidence from the Old World looks different, where proposed RA cases exist, but they're heavily debated. Placed side by side, these theories are reminders of what matters most in academic work, asking better questions. If RA is ancient, we must ask what long-standing exposure shaped it. If it is modern, we must question what has changed. And if it emerged after large-scale population mixing, we must examine infections, contact, and shared environments. Each theory is a lens, an invitation to challenge what we think we know. Asking whether the Vikings had RA is not really about the Vikings. It's about tracing when this disease emerged and why. Because curiosity is what makes science move forward.